The gluteus maximus is the largest and most superficial muscle of the gluteal region, located in the buttocks. It plays a crucial role in the movement and stabilization of the hip and thigh. Here's a detailed overview. Anatomy of the gluteus maximus. The gluteus maximus originates from several points: the posterior portion of the ilium, hip bone, the sacrum, the coccyx, and the sacrotuberous ligament. It inserts into the iliotibial tract, a fibrous band on the outer side of the thigh, and the gluteal tuberosity of the femur. Function. The gluteus maximus is primarily responsible for hip extension and external rotation. It helps in rising from a sitting position. This muscle powers the motion of standing up from a seated or crouched position. Climbing stairs. It helps in propelling the body upward, running and jumping. The gluteus maximus contributes to powerful leg movements like sprinting or jumping. Maintaining posture. It plays an important role in stabilizing the pelvis and maintaining upright posture during standing and walking. Movements. Extension of the hip. The gluteus maximus moves the thigh backward, which is essential for walking, running, and jumping. External rotation of the hip. It helps rotate the thigh outward, which assists in movements like pivoting, abduction and adduction of the thigh. It assists other muscles in spreading the legs, abduction, and bringing them together, adduction, during certain movements. Exercise and strengthening. The gluteus maximus can be strengthened through a variety of exercises, such as squats, lunges, deadlifts, hip thrusts, step-ups. Strengthening the gluteus maximus improves lower body power, enhances athletic performance, and supports overall hip stability, which can help prevent injuries. The biceps femoris is one of the muscles that make up the hamstring group, located at the back of the thigh. It is a two-headed muscle with both a long and a short head, each playing a vital role in knee and hip movements. Anatomy of the biceps femoris. Long head. The long head originates from the ischial tuberosity, part of the pelvis, and runs down the thigh, joining the short head before inserting on the head of the fibula, a bone in the lower leg. Short head. The short head originates from the linea aspera on the femur, thigh bone, and also inserts into the fibula. Function. The biceps femoris is responsible for movements at both the hip and the knee. Knee flexion. It bends the knee, bringing the heel toward the buttocks. Hip extension. Long head. It helps extend the hip, moving the thigh backward, which is essential for activities like running or jumping. External rotation. When the knee is bent, the biceps femoris can rotate the leg externally, outward. Movements. Flexion of the knee, essential for walking, running, and climbing stairs. Extension of the hip, especially important when rising from a seated position or during sprinting. Lateral rotation out the knee. When the knee is flexed, the biceps femoris assists in rotating the tibia outward,